Okay, this is part 4 of Dr. Mcdougall on heart disease, and we're talking about the results from surgery. I'm trying to get my background straight. This is my picture of my new apartment. Okay, so New England Journal of Medicine, 11-year survival, randomized trial of coronary bypass graft for stable. That's in key point. Stable angina. Survival amongst patients with impaired left ventricular function differed significantly at 7 years, but not at 11 years. So at 11 years follow-up, no significant benefit from the surgery, okay? Another paper, 12-year follow-up of survival for coronary surgery. And by the way, Dr. Mcdougall is great for this. And all of this stuff comes from the book, John Mcdougall, The Doctor Who Fought for You, written by me, Pete Rogers. And I'm telling you, Dr. Mcdougall is and I did this deliberately. I summarized his work with the references so that if you're going to get into a debate, an argument, a discussion, you want to research a topic, you'll have the key references. Mcdougall knew the literature better than anybody else, so he had it very nicely summarized, okay? And so what he's basically saying here is coronary artery bypass graft surgery, open heart surgery, the abbreviation's CABG, CABG, really doesn't do almost anything for longevity. Okay, but it has a lot of morbidity, suffering. Okay, 12-year follow-up. The benefit of surgical treatment tended to be greater, but not significantly so. The reasons for loss of beneficial effect from surgery after 5 years are unknown, merit further study. Yeah, because you can't bypass all the microvascular disease and you can't bypass the minor stenoses, which are the ones that actually go on to progress to plaque rupture, occlude the coronary, have an MI, and kill the patient. Plus, you get the comorbidity of potential strokes during the intraoperative procedure, damage to kidney function, damage to pulmonary function. Okay, another paper. 10-year follow-up and survival of myocardial infarction in randomized coronary artery surgery study. There was no significant difference either in survival or freedom from non-fatal heart attack, whether stratified based on heart failure, age, hypertension, or number of vessels. So what we're saying here is you go through this whole big procedure with a buzzsaw down your sternum and veins rerouted from your leg to your heart, the lumen to the LAD, left internal mammary artery to left anterior ascending artery. You go through all that, and there's no benefit in your survival. Why the heck go through it? I mean, that's the point. Another paper, comparison of surgical and medical group survival in patients with left main coronary artery disease. 1,484 patients with at least 50% stenosis in the left main coronary artery, the widowmaker artery, left main coronary, initially treated with either surgical or non-surgical therapy. Median survival was not prolonged by CABG surgery in patients with normal LV function. Normal LV function defined as ejection fraction 50% or greater. Same for patients with left main equivalent coronary artery disease. Like let's say you had severe stenosis in the origins of the circumflex and the left anterior descending. So once again, they're saying, this was the so-called area where you would expect a CABG to be of more benefit with left main coronary artery disease. That's the one they call the widowmaker. But even when the problem was in the widowmaker, no significant improvement in survival. Okay? And that's why you hear Mcdougall say you don't get an improvement in survival because he's gone through all the papers, and here they are. Okay, next one. Let's see. Reimbursement for CABG is about $150,000, can be as much as $200,000. This is Dr. Mcdougall's writing. The motivation is money. The patient be damned. There is a good documentary called Widowmaker that shows how patients and their families get talked into CABG. Dr. Mcdougall had a good quote. He said that the treadmill stress test, where you walk the treadmill stress test, he said, is a conveyor belt to the operating room. Okay. Typically, the sales pitch is that the doctor will tell the patient and the patient's wife that he has a widowmaker type of coronary artery lesion, left main coronary, and that he should go to the operating room or he could suddenly die from this widowmaker. Almost all patients fall for this. That's what they said when my father had it, and that was many years ago. I didn't know enough then. I wanted him to go on vegan diet, but I didn't know enough back then. I don't know what that was, 25 years ago. My dad fell for this trick at that time in my 30s. I did not know enough about diet and atherosclerosis to talk him out of it. I tried to talk him out of it, but my knowledge wasn't strong enough. You got to know what you're talking about so people can't bully you into, wimping out. But my knowledge wasn't solid enough. This was me talking enough at that time to convince him. By the way, I put my own comments in brackets, so they're not too much. Almost all of it's Dr. Mcdougall, but in little comments I'll put the bracket when I have something relevant to say. So my dad had the surgery and did okay with it for 4 years, but after that he had a dissection of his vertebral artery, which I think from shoveling snow, which I think was related to the cabbage, because when you staple the lima to the LAD, it's now fixed. And if you're shoveling snow, the snow's wet, it sticks to the shovel, you get that staccato motion. You can injure the He injured the vertebral artery, formed a clot, embolized his brain, he had a stroke. He had to retire after that. It was very sad. And he kind of lost his cognitive function. He could still talk to you, but he was no longer fully mentally competent or physically able to do all the things he used to do. And I think it was a dissection with a clot embolized distally to the posterior cerebral artery, because I saw the initial MRA with an occluded PCA, posterior cerebral artery on the right. Then he had a follow-up MRA 2 days later because there was some motion artifact, and that occlusion was gone. So it had lysed or embolized distally and broken up into smaller pieces. Okay, so bottom line, I'm saying the cabbage caused him a stroke 4 years later. That's what I think happened. Neil Armstrong, the first man on the moon, this is Dr. Mcdougall, died from what I believe was an unnecessary cabbage surgery as described in the September 2012 newsletter. During cabbage, the patients sometimes have embolization of atherosclerotic plaque or air bubbles to the eyes, the brain, and other body parts. References Journal of Circulation 2005, retinal eye and cerebral microembolization during cabbage. Retinal microvascular damage was detected in 5 of 9 cabbage patients. So more than half of them had at least a small embolus to their eyeball. And they were on cardiopulmonary bypass. But in none of the patients done off the pump. So cognitive impairment after cabbage is called pump head. Okay. Another paper here. Cognitive outcomes 3 years after cabbage. In relation to DWI, diffusion-weighted brain MRI. What they found is 51% of patients had at least one lesion that they thought was related to the surgery. So what they're saying is half of patients basically had evidence of some type of brain damage related to the surgery in the opinion of this paper. Okay, continue with results of coronary artery bypass graft surgery. Longitudinal assessment of neurocognitive function after cabbage. Paper from 2001. 5 years after bypass surgery, 42% of patients showed a decline in mental function of 20% or more. That's a big drop. 20% of cognitive or more of cognitive function was declined. So again, that's where that term comes from. Pump head noted in 20% of patients by 5-year follow-up. Okay, next article. Neuropsychological impairment after cabbage has been reported in 14 to 80%. As high as 100% in the elderly. Why? And again, this is Dr. Mcdougall writing here. Because a cabbage can trigger a stroke. Microemboli result in cerebral emboli due to toxic chemicals, flakes of plastic equipment, air bubbles, or clumps of fat. Okay, so that was the purpose of the talk today, to just tell you, you don't get increased survival for a routine cabbage, okay? And even with the left main, they didn't get it in the one paper shown here. And you do get a lot of comorbidity, and 5 years later, 20% have, detectable cognitive decline. So it's much better to fix your problem with a good diet, low-fat, low-sodium, vegan diet with no oil. That's what I would do rather than risk all these problems. Anyways, hope that was interesting.